Okay, hello everyone. My name is Renzo Zago. I am a global key opinion leader manager for Kulzer International. I would like to thank you all for attending in today's webinar. I have a pleasure of welcoming Dr. Alessandro Colella, who accepted to perform this webinar with very interesting topic, shade simplification, the future or the present of anterior layering. I think this is a very interesting and very actual question that Dr. Colella will be able to answer during the webinar, giving you many interesting ideas to quickly and easily realize your anterior restoration. Now, I would like to briefly introduce Dr. Colella, who is a general practitioner, an active member of Stile Italiano, speaker in several national and international congresses. As a general practitioner, he likes to approach his daily clinical practice with simple protocol and easy-to-use material, thus avoiding to manage complex workflow. He is a firm believer in the Stile Italiano philosophy, according to which restorative dentistry must be feasible, repeatable, and teachable. Now, before leaving the stage to Dr. Colella, I still have some technical information to share. All questions can be written on the dedicated space called question answer and not in the chat, please. And will be my commitment to collect and forward them to the speaker at the end of his presentation. Now, I wish everyone a good webinar, and I hand over to Dr. Colella. Are you ready?
Yes, I am. Thank you, Renzo.
Okay.
Thank you for your presentation. Let me say thanks to Stile Italiano and Kulzer for supporting me in my activities, for involving me in this project. Very ambitious. I'm very, very happy to be here today. Some information about me. I am an active member of the Stile Italiano team. I start to use Kulzer product very late in my professional life, but I'm very happy of this changing. And I'm pleased to start this webinar by showing an old clinical case I performed in 2018, about 8 years ago. So back then, performing direct restoration on anterior was a real challenge for me. So I used to schedule very long appointment and spend a lot of time selecting the right shade before I was confident enough to complete the restorations. So in this particular case, in this particular case, I took 1 hour 40 minutes to perform the restoration on the central. I've used one enamel shade, 2 dentin shade, a clear stain in the incisal. And even after 11 years of experience, I spot a few technical mistakes I did at the time. And basically, I've been a fan of the polychromatic layering since from my very beginning. Lorenzo Vanini is still a god for me. It's polychromatic layering. It's very, very amazing, astonishing. And university taught me that to achieve a beautiful and high quality restoration, I needed to use more than one shade in just 1 millimeter of thickness of the incisal edge. And the skill of the restorative dentist lay actually in the characterization of the incisal third. So perhaps it's true because it's very difficult. It's just a matter of skills, trying to characterize the incisal third, try to reproduce nature, and playing with thickness and by emphasizing the opacity and translucency, reproduce mamelons, giving the restoration a very lifelike appearance. So it's very difficult. It can be compared to an art, I mean. But I've always had doubts about whether if consistently I could consistently achieve a perfect polychromatic restoration for several reasons. First of all, the time required, because I mean, it's an obstacle for some patients. It's an obstacle for me, spending a lot of time to restoring one single central, having a clinic. even if I'm a general practitioner. So I used basically to jump from chair to chair, deal with surgery, periodontology, endodontics, restorative. The money, I mean, the economic factors, because spending so much time at the chair with the patient means an appropriate fee. And as a young professional, I lacked the authority at the time to ask my patient for a fair compensation, I mean, and perhaps I didn't have some patient at the time willing to spend a lot of money to be treated by a young patient. This is a truly consideration. And the reliability of my therapies, since many layers mean many risks and high risk on incorporating mistakes, and the reproducibility that was my very concern. So I'm not so sure to define this restoration as successful restoration. I used to say that it's a surviving one, since it's been going on for several years, for over 7 years. But literature says us that polychromatic layered ones, polychromatic layered restoration seems to age better than monochromatic layered ones. But what really happens to anterior restoration when restored polychromatically, maybe? So where we can face with a degradation of the margin, a plastic appearance of the central, the wrong balance between opacity and translucency, bubbles, some of them are often pigmented. So there were no efficient system 7-8 years ago, like OptiShade, for example, to match properly the color. But get a nice restoration was a cocktail between skills of the operator and experience. So you can figure out how difficult it is to collect these two requirements in a young patient. And I used to mention a survey by Style Italiano that highlights a truly discouraging fact about the class 4 restoration. On average, a dentist performs 4 direct restoration per year. So this is a tragedy. So do you really think that 4 restoration per year are enough to experience about anteriors? So I want to analyze which are the main issues with anteriors. First of all, the color mismatching. The first concern of the dentist, of the general practitioner, but also the restorative dentist, because it's very difficult to balance dentin and enamel shade in a polychromatic approach. Secondly, the secondary caries, that's a mix of which bonding we have used, which composite we chose, how we perform the restoration. For example, we used a rubber dam, we not. Let's say a lot of factors can influence the secondary caries appearance. And the chipping, that means that maybe we face with even less effective mechanical properties over the year. This is a crucial aspect I could take into account during my further slides. So you already know this patient. Salvatore is a very friend of mine. He's a general surgeon. He had a skin trauma. He had nasal bone fractures, hemosinus, zygomatic arch fracture, full face ecchymosis, and a class 4 of the upper lateral. So he's a general surgeon, so he can't stop. So he asked me for fast revolution. And since it's very sore at the time of the restoration, he asked me to be fast. So what I did, I placed the rubber dam at 1332, and at 1351, I already performed the full restoration by finishing it, by polishing it. So it's a very, very fast resolution of the missing incisal corner, incisal third of this lateral. What did I use? The Venus Perlite, a new simplified shade system by Kulzer that is based basically on 4 shades we can choose among: light, medium, dark, and a bleach shade. So I want to focus your attention on the aging of this material. after 5 weeks, it shows a very lifelike appearance, a very flawless appearance outcome. From an aesthetical point of view, about the shaping, about the tertiary anatomy, the surface on top. So it's very, very natural in its appearance. So I had basically to review in the last year my goals in dentistry. As a general practitioner, because I'm fully passionate by restorative dentistry, but I'm general practitioner, so I need to go fast. So my mantra actually is the less stress and more success. How can I can catch up this target? By maximizing simplicity. And that's why I'm very happy to introduce this Venus Pure composite. That's the product line for maximum anterior and posterior simplicity. There are 2 colors. On your left side, the diamond shade, the diamond consistency, and on your right side, the pearl consistency that refers to a material that it's firmer, it's more stable, the diamond one, and the pearl one, it's softer. So it's up to you. Choose your favorite handling when you use the composite, but it's the same from a mechanical point of view and from an aesthetic point of view. It's just a matter of handling, so you are more confident with. Which are the strongest point of this kind of composite? First of all, the easy color matching, because the Venus Pure shades have been optimized to match the corresponding Vita shade range for a perfect balance between translucency, hue, and chroma. So the shade adaptation leads to a seamless integration in the natural tooth shade in even monochromatic applications of anterior and posterior cases. I asked Jordi Manauta a courtesy to give me some slides about the correspondence between the Vita shades, the conventional Vita shades, and the 4 shades by Venus Pearl. And so basically we have these 4 shades, and you can see how they matched with the conventional Vita shade. For sure, the bleach shades are not inside the Vita shade, the conventional Vita shade are from the bleach Vita shade, but you can see how the light corresponds to A1, B1, B2, C1, D2. The medium shade is A2, A3, B3, C2, C3, C4, D3, D4. And the last shade, the dark one, is for A3.5, A4, B4. So basically, if we switch from light shade to medium shade, we can cover the most of the shades belonging to the conventional Vita shade. This is very crucial, because if we start from the idea, we can face on anteriors 80% of the time by using a monochromatic approach. Inside these 4 shades you can choose among, you have the light and the medium that cover 80% of the 80% you can approach with the monochromatic layering. And what about the chemical features of this composite? Because that restorations used to fail mainly because of fractures and secondary caries. So Kulzer developed the TSD urethane-based composite to reduce the risk of fractures and secondary caries. How does the TSD work, and how the TSD is made? Basically, the TSD urethane matrix can guarantee a high strength to resist the masticatory forces and a low shrinkage stress to protect the marginal integrity. And how does it work, basically? Is made by a rigid core structure with minimized vibration movements that lead to higher packing of molecules that provide a lower shrinkage stress. An urethane functional group with an improved reactivity to double bonds, and this means the increasing of the mechanical properties and good biocompatibility due to the higher degree of conversion. And the side chains that have optimized size for improved elasticity and reduced contraction stress at the formation prevent marginal gap. So that's why I decided to use this promising composite in one of the bugbear in dentistry, for example, the replacement of the incisal edge in a patient who suffers from an edge-to-edge bite contact. And this is my best friend's mom. So she broke her central and she need to replace it. And I placed the rubber dam and I replaced the missing incisal edge by using the Venus Pearl medium in just 1 layer, just 1 shade in a very few minutes. So this is the final result, and thanks to this close-up, you can look how nice is integration in terms of balance between opacity and translucency, and how marginless is the restoration. So it becomes very, very easy and working in everyone's sense to replace what I think is the most challenging restoration in together with the class 5 restoration. So I already texted an article about this clinical case I'm going to show you in now. This patient came to my attention in 2022 complaining this hypoplasia on the upper canine. So I told the patient and his mom that the hypoplasic area tends to become darker over the year, since the enamel and the dentin, the exposed dentin, are very porous. So the tissue tends to trap some pigmentation, for example, from food. And in fact, after 1 hour and 1 year and a half, in 2023, the patient came again to my attention by showing this brownish dyschromia on the upper left canine. So since he complained bad aesthetics, but since he needs for an orthodontic treatment, I decided to cover the hypoplasic area by using the Venus Pure before getting braces on this patient, because he's a candidate to the orthodontic treatment. I placed the rubber dam and displaced the rubber dam as much as I can by using a bringer clamp, B4 clamp, in order to expose as much sound tissues as I can. And I removed the pigmentation from the hypoplasic area by sandblasting it with aluminum oxide in 29 microns by AquaCare. So total etch was forced because it was impossible to distinguish enamel from dentin, and so I decided to apply everywhere the etching gel. And usually on anteriors, I used to bevel the facial surface of the tooth, because it becomes easier to hide the margin between composite and natural tooth, to guarantee a nicer blending between these two tissues materials. And in this specific case, a bevel would increase my invasiveness. So I decided not to do any finishing lines. And anytime I decided not to get a finishing line, I used to over etch the enamel surface to let the bonding well penetrating inside the enamel after etching the etching phase. So I used to extend the etching very beyond the hypothetic margin of the tissue has to be treated, and this allowed me to get the transition between natural tooth and composites very, very invisible. So after etching both enamel and dentin, I used universal bonding by Kulzer, the iBond universal, as a first choice. In this specific slide, I'm showing you a compo brush. The compo brush is thought to grab the composite over the margin, so it was not born for bonding placement. But it's very nice because its whisker are very, very flexible. So they are able to get in through the diastema, the proximal areas, both mesially and distally. But remember, guys, that it's not, it's for a single use only, basically. So you can use it, yes, right, but for a single use. After that, after curing the bonding agent, I cover all the exposed dentin by using the Venus Pure Bulk Flow 1. That basically is a flowable one-shade bulk filling material. It's very easy to be spread on the exposed dentin, so it makes very few bubbles, and it's colorless, it's shadeless, so it's very suitable to underline the further packable composite. In fact, I decided to use to pack my composite, the Venus Pure Medium, in just one layer to replace the missing tooth, the missing structure of this upper canine. And so no matter with a definitive shape after modeling, because as Style Italiano uses to teach, we get a very proper finishing and polishing procedures after that. So small correction are usually required in terms of length, but afterwards we can follow some basic rules to get the transition line first, to decide understand how optically the tooth surface has to reflect lights. And after that, we can go with the further polishing that I carried out with Venus Supra by Kulzer. There's a tailor-made polisher system for Venus composites, and basically a two-step polishing system that consists of a pre-gloss, the pink one, and a high gloss, the gray one you are going to see later, that you can use at maximum 10,000 rad/pm. So be careful not to overcome 10,000 rad/pm, but my recommendation, the company recommendation, is to get the optimum rotation speed as 7,500 RPM, and under water cooling. It's very, very crucial. They are made of silicone highly filled with microfine diamond powder. So that's why if you push a lot on the tooth surface, you can erase the tertiary anatomy, you can make some depression of the tooth surface. So be careful when you use it, be gentle with this pressure system, and respect the company indication about the using. So not to, on average, to use it at 7,500 RPM. This is the selective polishing that I performed to emphasize the anatomy, because the upper canine has a long axis and has a symmetric axis, and the eye gloss polisher used with a great pressure in this phase to emphasize the anatomy. So we work beside the symmetric axis in order to emphasize the prominence of the symmetric axis, and this seems to reflect the light in a better way. And Lucida system is my very cherry on the cake when I perform the polishing procedures, because it's composed by a Lucida Star disposable felt, Lucida mandrel, and a Lucida paste that allow you to get an extreme gloss in combination with the felt. So the advantage is star felt because it's intermittent when acting on the tooth surface, and this allow you not to overheat the composite and the underlying dentin or enamel as well. And it's very, very nice to get in through the proximal space, so in between the adjacent teeth. And this is the outcome before and after the rubber dam removal. This is after 1 month, and this is after 1 year. So it's very, very nice because allowed me to be very fast and effective to replace the missing structure of this hypoplasic canine. And the patient is fully satisfied, me as well. So that's my goal. So the question now is, how do we choose the color? So I asked Jordi Manauta, one of my mentors on aesthetics and restorative, to explain us is realistic try-in. So what does Jordi Manauta mean for realistic try-in? We need some composite. We pack some composite with your finger, with your spatula, with your favorite instrument, however you want. And you get some correction to give approximately the final shape of this restoration. And after that, you cure the materials, you get some correction in terms of shapes. And after that, you ask your patient to fully hydrated his her teeth to simulate final restoration. So we need to cure the composite first and to fully hydrating in it. And since we reproduce the very final outcome of the composite. So in this specific case, Jordi decided to treat these fragments as a partial indirect anterior restoration. So he cemented them on anteriors, and he replaced the missing part of these 2 teeth in a very effective way, in a very performing way. A really nice case, a very tough case, since the patient shows 2 different dyschromia on their central. On your left side, an MIH lesion, so a molar incisor hypomineralization. So be careful, because when you used to open this lesion, you are going to go very, very deep in dentin many times. So it's very difficult to hide a so wide spot. On the other side, on the left central, we have a traumatic lesion or infective lesion due to a trauma or infection that occurred in this patient, maybe during the pediatric age. So it's very nice to reflect how different diagnoses require the same approach. Underexposed peaks are very useful, very helpful to better know the diagnosis of these 2 spots. and to better know which are the translucency of each tooth and the dentin and the enamel and so on. But basically, I want to go monochromatically in this way. So I place the rubber dam. I gently remove by sandblasting the very outer enamel. I used to bevel all around the two spots in order to guarantee my composite the right thickness to emphasize its opacity at hiding the margins. I over-etch the enamel since I want to really go beyond the margins. I had to restore the universal bonding, and after that I decided to treat them in the same way by using two different shades, the Venus per medium on the left side and the Venus per dark on your right side. So different shades, same approach, same clinical resolution. So it's very, very nice how beautiful is the appearance of these two centrals, how seamless is appearance, how glossy are these restorations. So I'm very fully satisfied. Now it's time for a very complaining patient, a high demanding patient. Andrea came to my clinic asking me to improve hair aesthetics. So I told Andrea, you already has a beautiful smile. You don't need anything in dentistry. But we decided altogether to perform an home bleaching to reach this brighter result and to get to make this patient very happier. And I decided to treat this hypoplasic area on the cervical zone of the upper lateral. So I'm showing you this nice instrument, my favorite one, when I decided to restore the cervical area. It's called Gengiva by LM. It has three different size tips according to the root contour, so you can choose the best one to better adapt the root contour. And if it's not very, very precise, you can improve the shape by using, for example, an abrasive disc to improve the adaptation around the tooth, the root contour. And that's why I consider class 5 restoration very, very challenging, because it's difficult to displace the rubber dam and expose the zone, the area of the tooth we are going to treat. So it's very difficult. That's why I decided to use the LM Gengiva. And it's very evident that some excess of gums are inside the apoplastic area. So when you perfectly seal by using the tip of Gengiva, you can remove the excess of Gengiva by using a scalpel, and you finally get your nice result, your nice restoration with a single layer of the Venus per light in this specific case. But this close-up is very helpful because it shows you how is biocompatible this material, because look at the gums, there are no signs about inflammation, and look how flawless is the integration, in aesthetically speaking, between the composite in the cervical area and the underlying sound tooth. So it's very, very nice and very easy to perform, and very, very repeatable in everyone's sense. That's my goal. So if you need some information about our protocols, about our recipes on restorative, basically, you can choose you can surf on styleitaliano.org website. And for example, I'm looking Jordi Manauta and his closing gap technique. And we used to publish a lot of articles regarding many disciplines, but moreover restorative, but a very fully detailed protocols for any kind of therapy, any kind of restoration you can perform in your daily practice. So this allows me to introduce this upcoming case about a wider class 5 restoration. As you can see in this picture, this is an even bigger tip for the gingiva. So look how ischemic is the gingiva around the area we have to treat. So it's very, very effective at displacing the gingiva and exposed the sound dentin underneath. So that's why I usually prefer to extend my isolation, one tooth before and one tooth after at minimum, and to use the gingiva to keep it in position with my left hand during all the appointment, the layering phase, to get the gingiva retracted, and to better know how I have to position my margin, my apical margin. Because when we perform the class 5 restoration, we used to get a chamfer, or we used to get any margin, but we need to ensure that our composite is going to have the right thickness to emphasize its mechanical properties. It is very crucial if you want to get your class 5 restoration very durable, very long lasting. And I used this burr, this chamfer burr from Uno kit, a new kit we are developing as Style Italiano members that collect 10 burrs to approach of managing both anterior, posterior, direct or indirect restoration. So they are very effective and very simplifying, and are able to speed up your restorative procedures and your cavity preparations. So I used to respect the gums anatomy around tooth, and afterwards I can take the old fillings out by using the cylindric round-ended burr belonging the Uno kit we are developing. The dentin surface is always refreshed using a low-speed round burr on a handpiece. It's very, very important. And finally, a vestibular bevel is created to improve the transition between the tooth and the restoration and to hide properly the margin. And it's very important to finish your margins by using, for example, abrasive discs. So you can use more than one grain. So starting from the rougher, the more aggressive, up to the less aggressive one. And optionally, you can use, for example, a brown rubber polisher. But remember that if you use with a not so gentle pressure the rubber dam on the vestibular side, on the bevel, for example, you can wear the polish and you leave some rub particles inside the bevel. So that's why I recommend you to use it anytime you want, as long as you use the sandblaster, because you can remove at the same time some particles belonging to the rubber used, and you can remove some smear layer during your preparation of the cavity, and you can increase roughness in order to enhance the bonding penetration inside the substrate. It's very important to get a very stable hybrid layer. As you can see, the gingiva is very effective at displacing the rubber dam first and the underlying gums during my further procedures. So I selectively etch the enamel for 30 seconds. I use the iBond universal to get my hybrid layer. And afterwards, I'm very delighted to introduce the new material. It's going to be launched during the IDS at the end of the March in Cologne. And this is the Venus Pure, basically, but in a flowable consistency. So it's very, very nice because it has the same opacity, the same translucency. So it's basically the same material in a different consistency. But from a mechanical point of view, you should avoid to get it in a very stressed part of the tooth, because it's not so hard to resist, mechanically speaking, as the packable version of the Venus Pure. So you can use, for example, like in this case, to perform the immediate dentin sealing, you can spread the flowball on the exposed dentin by using the fissura by LM, and afterwards, after measuring how big is your cavity to be treated, you can decide to follow the closing gap technique, for example, starting from coronal up to the apical part of the tooth to be treated, and splitting the increment as long as you use up to 2 millimeter thickness of composite at a time. So it's very important. We should leave a small gap. That's why we used to call this technique a closing gap technique. And you can get a small drop of this flowable composite, and you can spread it by using the fissura to perfectly seal along the margin. So a visual check is often required to be sure that you're ready and effectively close all the cavity. And afterwards, we can finish the restoration by following the cuvata planes, that are the 3 planes that basically characterize every anteriors, and using this fantastic low-speed diamond burr that I used to call magic burr, because I can finish the restoration by reflecting the cuvata planes first. I can remove the overlapping of composite. I can contemporarily draw the tertiary anatomy, so the well-known perichymata, and by using it at low speed. So it's very, very effective. You can use the brown rubber. Occasionally, if you have still some excess to removed, and afterwards you can carry out your polishing and glossing by using the Kulzer Sopra rubbers. And I remember you to use at maximum 7,500 RPM under cooling with air water spray in order not to overheat the composite and the tooth. And so this is how my restoration look like after finishing and polishing. And this is my very goal in dentistry. So what happens after 3 months? No signs of inflammation of the gums, a nice integration, and a very fast therapy by using just one shade in 2 different consistencies. So it's a very, very satisfying for me. A very bugbear, because this patient came to my attention at 7 p.m. And asking me to replace these class 3 that show to be infiltrated by affecting by secondary caries. So I placed the rubber dam. I will go very fast about regarding the steps, because are always the same as the style Italiano used to teach as a protocol. So I placed the rubber dam. I protect the adjacent teeth by using this new interproximal tooth protection matrix that are very effective at protecting the adjacent teeth from any aggressive step, for example, the burr action or the sandblasting. And I used to overretch the enamel as usual. After that, I used the I-bond universal. I covered the exposed dentin by using the venous pure diamond flow. I spread it with the fissura. And now it's time to rewall these missing proximal areas on these incisors, lower incisors. So this is respectively the Bella forceps, a multifunctional forceps, very, very helpful, or in your daily practice you can use it for bring your matrix and getting through the interdental space. You can remove the matrix. You can put the post in the post space. You can cut safely by using aggressive disc. You can remove the provisional. There are very, very, very so many advantages about using the Bella forceps, and these new kind of matrices are called the unica proximal, that basically are the sail-shaped matrices. You can use it in between to reward the proximal areas that are missing, and thanks to its shape you can embrace the papilla apically. You can reward properly the missing part of this tooth because it's very anatomical. This is a close-up of they look like when I decided to restore all the 3 cavity in this patient. And so some adjustment of the matrix positioning can be required, like in this case, for example, it's a bit open apically to the 3.1, and it's a bit close on the incisal edge of the 4.1. So you can get in stretched or twist during the further modeling or layering procedures, and it's possible to pack all the composite in just one layer also in this case, because the self-polishing phase of this matrix is very, very effective and reduce your chair time at finishing and polishing proximally. And this is the final layering. And tips and for the attendance of today's webinar. And when you have to remove the excess, remember not to start from the margin in order to avoid any scratches of composite from the margin. So you don't have to get the composite away from the margin, but start from the middle of your increment and remove let's say 50% coronally, 50% apically, in order not to scratch the composite and to detach the composite from the margin. And this is the first one and the last 2 class 3 that I've just replaced. And from lingually, I have another class 3, a very small one. So, as I told you before, the flowball composite, the venous pure and flowball consistency, is not suitable to replace a very stressed part of the tooth. So that's why you can use it safely in this kind of restoration by employing this nice matrix that are self-polishing. And so by using 1 drop of this flowball composite, you can replace the missing part of the tooth, and you can catch up the goal in a very short way. Finishing and polishing procedures are always the same. This is the final outcome before and after removing the rubber dam, and this is after 4 months in a very praxised patient. So it's very, very nice how the material is resisting, and from a mechanical point of view is very performing. This case is very, very tough for me because the patient has a severe malocclusion due to a crossbite, and I need to replace a missing incisal edge in a crossbite patient by reproducing also translucency in the incisal edge. So it's very difficult by layering monochromatically, I mean. So in order, I get the rubber dam in place. I'm beveling the facial surface, and I prepared a butt joint proximally and palatally. I used to finish my bevel by using decreasing grain abrasive discs. And I protect the adjacent tooth from sandblasting. I sandblast all the surface. I overetch the area to be treated. I use the universal bonding. I cured the universal bonding. And this is a trick to use this venous pure diamond flow. You can keep the unica proximal displaced. You can fix it with a small drop of the diamond flow. You can curing it, getting the matrix basically displaced. But as I told you before, it's not suitable due to its mechanical properties to get into edge-to-edge bite contact. So that's why you have to shorten a bit this increment, and don't waste your money to ask your dental technician to make some silicone index to replace a 1 millimeter thickness marginal incisal edge. So no need. You have more than one fingers you can use, and choose your favorite one. This one is mine, and you can put palatally and pack some composite on top. You can replace the missing incisal edge, and afterwards you can characterize your incisal edge by using a stain, a blue stain, not belonging the venous pure shade, but belonging another shade system I will talk you later. And afterwards, you can close the box by using the venous pure medium in just one increment to fulfill the cavity. So it's time to finishing and polishing procedures. So essential shape is very helpful in that sense. You can get and fix the transition line first, as you decided how wide, how small have to be the reflecting area of the central. You can shorten with abrasive disc a bit the marginal edge, the incisal edge. You can use the magic burr to remove the overlapping of composite and contemporary draw the tertiary anatomy. And you can also remove some excess from palatal by using the football burr by UnoKit. And after that, you use the venous polishers, the pink one and the gray one, to emphasize the glossy aspect and in a durable way. And that's my goal, basically. So I went monochromatically. So actually, I used just one small drop of the blue stain inside the incisal edge in order to emphasize the inner translucency of this tooth. So basically, a monochromatic approach plus small tips inside the incisal edge to reproduce anatomy and reproduce nature. And that's my final outcome in static occlusion. So for any further tips or tricks, you can find everything in these 2 books, Layers, that basically is a color atlas. So regarding every extraoral procedures, so working with composite outside the mouth, and Layer 2, a very recent book and very collecting and fully comprehensive book that collect every clinical cases regarding Study Italiano's protocols, and from the authors of these books, but also by me and other active member of the group. I'm getting closer to the finish of this webinar. This is a very nice case since the patient came to my attention showing these fractures on central, but also this meniscus cap on cusps on the upper premolar. So what I need to do, I'm a general practitioner. I want to go fast. I want to jump from chair to chair. dealing with many disciplines of dentistry. So I don't stop and I don't split in 2 appointments. 1 hour is too enough to get these 2 therapies. So I made a composite up. I get some packable composite. I put in order to replace the missing cusp, I get some correction with the abrasive disc and with thanks to an articulation paper where we remove the premature contact. And after is already set, I can place the rubber dam. And I decided to start from the central. I protect the adjacent tooth. I go with the selective etching of the enamel. I use the universal bonding. I fix the matrix in between the 2 centrals by using a venous pure flow ball. And I shorten a bit the incisal edge, the missing corner, the just replaced corner that I replaced with a packable material, the venous pure and a packable consistency. And after finishing and polishing, this is the final outcome of my restoration. So it's very, very nice. It's very, very flawless. And what about the premolar? So I used to deal with prosthetics mainly in my chair time. So I waste a lot of silicone. And this is a silicone, fast onset silicone for bite registration. It could be helpful in this kind of procedures. So I take an impression from the composite app. I use the silicone index to replace the missing cusp. And afterwards, I close the box by rewalling distally and partially by positioning 2 sectional matrices. And afterwards, I decided to sculpt the occlusal surface by following the essential shape layering technique by Giuseppe Chiodera and Style Italiano. And this is my basically a full crown direct composite restoration. So the aim of these slides was to suggest you to use just one material if you want to arrange any kind of procedures, both on posteriors and anteriors. This is the underexposed peak to check the balance between opacity and translucency. So I think it's fully satisfying. And after 3 months, this is the final outcome. The patient is not Guinness World Record or oral hygiene, but basically I tried to do my best by replacing all the missing structure of this tooth by performing a full crown direct composite restoration. So I'm very satisfying about it. And this the patient seems not to be very happy, but this is her smile. 2 cases left. This is Andrea. Andrea is a very, very difficult patient because he's one of the most famous techno DJ in the world. So he has no time, basically. So I need to go fast. And moreover, he is gonna get married in 1 hour and a half. So he came to my clinic asking a better aesthetics. So I decided first to make an oral hygiene and bleaching to improve the healthy gums and his appearance and self-confidence. And after that, I asked my orthodontics, Dr. Elena Pettina, to perform orthodontic treatment. So I asked her to plan the crossbite correction, and she decided to expand and distalization to correct the crossbite through expansion and distalization. This is the first intermediate phase before restoring that show the malocclusion that the patient suffer from. And this is the changing in arch. And this is the clean check that show the movement the teeth are going to do during the orthodontic treatment during the first intermediate phase. So it's a very, very difficult case in an adult patient. So we need to stop our orthodontic treatment due to the patient's marriage. So he needs finally new restoration on 1.1 and 2.1. So basically the steps are always the same. So first of all, the isolation. Afterwards, I bevel the buccal surface and I get a bud joint palatally and proximally. And I etch the enamel for 30 seconds, extending beyond the margin. I used universal bonding, I bond by Kulzer. I get the 2 unica proximal matrices to revolve both central at the same time, so I get it in between at the same time. And Bella forceps is very, very helpful to remove the matrix one by one after building each missing wall. So once the 1.1 is just restored, Unica proximal is still in place for the second restoration. And afterwards, I can replace the missing corner of the 2.1 by using the Venus Pure shade, the Venus Pure light shade in a monochromatic layering with this simplified shade system. And I get the primary anatomy by shortening the centrals. I draw by a pencil the transition lines, and I use the second the magic bird to reproduce the secondary and tertiary anatomy. This is the restoration that I've polished. And the cherry on the cake is always the lucida system, because I enhance the polished aspect, the very glossy aspect of these two centrals. And this is the immediate final result that the patient is got ready to restart his orthodontic treatment and finishing orthodontically speaking. So I want to finish my webinar with a collecting clinical case regarding the use of this composite on anteriors and posteriors. So she's an old patient, is 75, she's 75, 76, and she asked me to improve his oral health. So I decided to split the resto appointment in two different appointments, focusing first on the facial side of the teeth are going to treat, and afterwards bipalatally. So I can't use the gingiva by LM to restore the more distal tooth in the patient's mouth, so I decided to use that 2-1-2 conventional clamp to get the rubber dam displaced at the underlying gingiva as well. And I can use the etching gel, the bonding. I cure the bonding. I seal immediately the dentin, the exposed dentin, by using the Venus Pure flow. I fully cover the exposed dentin with the flow by using the fissura. And afterwards, I follow the closing gap technique steps to replace the cervical area and to restore the cervical area. So since the 2-1-2 is very bulky, I had to change the clamp to get the rubber dam displaced, and finally I can use the gingiva by LM. This is very, very, very nice, because look at easy is to get the rubber dam displaced, and how much sound dentin and cement you can expose lifting the rubber dam by using the gingiva LM. So the steps are always the same. Basically, I sandblast the surface, I etched, I used universal bonding, I cover the exposed dentin, I measure the class 5, the cervical area, in order to decide how many layers I have to use to restore the cervical area, and I pack some composite up to leaving a small gap between the natural tooth underneath and the restoration. And thanks to the flow ball, I can seal perfectly the margin. So I run through along the margin to perfectly seal it. And this is how. So I can move mesially to the lateral. I'm skipping the steps because are very always the same. Oh, this is the compo brush I've showed you before about the bonding, but it's very, very suitable for dragging the composite over the margins. And now it's time to replace the missing incisal edge on the central. So I remove the old restoration, I take the old fillings out, and I bevel the surface. I get a butt joint palatally, and I can finish the vestibular side, the vestibular bevel, by using abrasive discs. I sandblasted the margin, and afterwards I overextend the etching gel on enamel. I use the universal bonding. I use always the same finger that before to replace the palatal shell. I fixed the palatal increment by using the small drop of Venus Pure Flow Ball. And afterwards, I can close the box by using the packable composite on top. So the compo brush to better adapt the material towards the margins. And this is the final result after layering. So some adjustments are obviously required to fix the length of the central, but run through the finishing and polishing because I need another appointment to restore the palatal side of the same teeth. So these are the steps about the finishing and polishing, and this is the final outcome. So after 1 month, the patient came again to my clinic, and so it's time to replace the veneers on the veneer on the 1.1 and to replace the old fillings palatally from premolar to central. Before remove the old fillings, I get an impression with a fast onset silicone index that I used before for bite registration. And so I fixed the silicone index by using the flow. Afterward, I stamp the palatal shell, and afterwards I rewall mesially and distally the box by using the Unica proximal that I already told you about. And so this is the box that I have to fulfill, and thanks to the same shade, the same composite and a packable consistency, I can replace the missing enamel and dentin at the same time. And afterwards I go distally towards the lateral and the canine. This is a sectional matrix for posteriors. You can twist them to make it better adapt to the missing corner of the tooth. And from palatally, I have another small class 3 to be replaced, and it's very, very easy to replace it by using the flowable composite. So I used to work on dryness on the surface, since I don't want to move the powder away during the finishing and polishing procedures, since I want to be sure that I'm using the burr to all the exposed surface and all the treated surface. Also, this is very important if you want to improve your skills at restoring, at finishing and polishing procedures. This is the final outcome. The restoration on 1.1 seems to be grayish. But what happens over the month? This is the patient new smiles after 4 months. So it's very, very nice how easy it was to replace the old fillings and to give this patient again aesthetics. From a palatal point of view, look how nice is the integration in terms of marginal adaptation and of the composite. There are no signs about the wear, even if 4 months are passed. So there are some clinical cases you can't use the Venus Pure. And basically, Kulzer offers us another choice, the Venus Art, because art shades are suitable for polychromatic layering to maximize aesthetics. So that's a perfect clinical case to showcase how to layer in a proper way the dentin and enamel shade. And so remember not to force and stress the monochromatic layering every time, but on average, you can use a Venus Pure shade, let's say in the 80% of your clinical cases, and otherwise you can choose a polychromatic approach like in this case. Okay, some small considerations about this webinar. First of all, if you have any doubt, you can look for Alessandro Colella on Style Italiano and looking at my articles I've just published on our community. Afterwards, I want to give you some take-home messages. First of all, you should consider a direct restoration with a monochromatic layering approach before opting for complex stratification. So start simple and focus on achieving optimal functional and aesthetic results without overcomplicating the process. Secondly, creating the correct shape and hiding the margin are the most important aspect of successful restoration. So small color mismatches, and I'm pretty sure about it, are often undetectable by patients. So prioritize form and margin integration over perfect color matching. In case of necessary correction, it's easier to adjust, obviously, a monochromatic restoration and a multi-layered one. So monochromatic restoration allows for faster and more effective modification, saving time and effort. And finally, time is our most valuable resource in dentistry. So efficient treatment planning and restoration techniques like monochromatic layering help to maximize clinical efficiency and reduce chair time for both the practitioner and the patient. And last but not least, this is a warm invitation to all of you, attendants, friends, colleagues, to become members of Style Italiano family. Basically, we have this new platform thought by the Style Italiano's founders and the Style Italiano Endodontics founders, which we talk about training first. We can schedule monthly meetings with all of us members of the Style Italiano on various topics. And we have a website to showcase your skills as a Style Italiano dentist. So improve your skills and let us know how you are improving. And last but not least, some benefits. For example, about products we developed during these years. We don't sell anything, but we help the market to improve the dentist life, the dentist routine, by developing some instrument and by publishing some protocols, simplified protocols in that sense. So become member of Style Italiano family. Thanks to all of you for attending and enjoying this webinar, and I'm yours for any further questions.
Thank you, Alessandro. At the moment, there are no questions so far. So I think we can end the webinar, but before closing, I would like to thank you for the very interesting cases and contents shared. And thank you. I would like also to remind everyone that the webinar is recorded, so everyone will be able to watch it afterwards. Anyway, everyone will receive an email with the link of the recording afterwards. Thank you for participating. I hope this webinar has full met your expectation. Thank you again. Thank you, Alessandro. Thank you for all the participants. Just a few seconds. Now I have some questions, sorry. Last minutes question. What is the name of the LM instrument you used to retract the gum?
Okay, sorry for my poor English. Many friends kidded me about my English with a Napoleon accent. So basically, it's Gengiva by LM. Gengiva is gingiva in Italian language. So Gengiva by LM basically is an instrument very suitable for retracting gums, and up to you if you want to use under rubber dam isolation or not. It's not mandatory. I used to isolate every time, but up to you. There are 3 tips you can choose among, depending on the root contour. So for the smallest one, for a medium-sized one, and for bigger one.
Okay, another question. Why didn't you use Icon?
Because Icon is not effective on MIH. So it's a matter of histology. Since Icon is very suitable to erase a white spot on anteriors due to fluorosis and early caries, because the depth of the penetration of the Icon is up to, I think, 100 microns. So MIH is very, very deep in dentin sometimes. So it's not effective. You can have what in literature is called as the halo effect, because the spot is let's say 2 millimeters vestibularly and deep indenting is 3 millimeters. So you can go by infiltrating the spot vestibularly, but you're not so sure to infiltrate in the underlying dentin. So the white halo remains underneath your infiltrating white spot. So that's why Icon is not the very most effective choice at treating the MIH lesions.
Yeah. Another question. How do you know how many layers should we use in class 5 cavities?
It depends on the class 5 size. So you should take into account that composite require to be applied up to 2 millimeter thickness. So if the cavity, for example, is 4 millimeters, you should use 2 layers. Okay, it's a matter of C factor, because it's very, very tricky in that area, and it's a matter of shrinkage stress due to the material itself. So basically, and on average, 2 layers, 3 layers maximum.
Another question about the bonding. Why did you prefer an universal adhesive when you work on enamel? Sorry.
No, there are no reason why I prefer the universal bonding on enamel, because many companies and many bonding are very effective in that sense. But I want to simplify my daily routine. So I want to choose the right bonding agent that is very, very effective and performing in every clinical situation. So from the small replacement of the missing incisal edge up to the deep cavity on posteriors. So I want to simplify and I want to shorten the list of materials I have to buy in my daily routine and my clinic. So that's why I decided to use the universal bonding every time.
Okay, thank you. What is the name of the polishing paste?
Lucida. Lucida is an Italian word, Lucida. It's by Shine and is powered by Style Italiano. You
I
can
think
find.
it could be, sorry, Alessandro, I think it could be a good idea if you want to share, you can answer him writing down the name in Italian language.
Okay.
Okay, or I can do it. Anyway,
Oh,
do you
text me on Instagram or by email and I can reply.
Okay, what is the name? Hello. Do you like to use gingival LM instrument or gingival thread?
Oh my God. I don't know what is the second one. Gingival? Let me. Domanda.
You can check on the question if you want. You can scroll.
Okay.
Okay.
No. I want to use Gengiva LM instrument every time I can because thread is a bit dangerous over 15 minutes inside the sulcus.
At which size of the tooth defect do you decide for indirect silicon index?
And there's no perfect reply to this question because it depends of many factors. First of all, the time I need to replace a defect. And secondly, the economical factors due to the patient. So asking my dental technician to prepare a silicon index according to a WhatsApp is not so cheaper as you can figure out. So many time I use my fingers to replace the palatal shell, and since my dental technician used to say beautiful anatomies, but I'm not able to reproduce the vestibular side, basically I waste a lot of information from my dental technician because I love to sculpt the facial side of my anteriors. So basically I need just for the palatal shell, but it's too easy to replace it by using your finger. So that's why many time, 80–90%, I use my finger to replace the defect.
Okay, how do you treat class 5 under the gingiva?
So actually, if you use the gingiva to perfectly see the root contour, you don't need to go so deep under the gingiva. But I use, because the excess you have to remove are really few. But thanks for your question because it's very interesting. I use the reciprocating handpiece by using the bevel burrs. Because they have a smooth surface and working surface, you can work underneath the emergence profile, and you can smoothen the emergence profile. So it's very effective at removing the excess underneath the restoration.
How do you manage translucent edge?
And depending on the cases, but as I shown you in the slides, I used the Venus art stain many times because you know, guys, that composite emphasizes its opacity due to the thickness. So The thinner is the composite applying, the more translucent. And that's why I can make a sandwich between the palatal shell and the vestibular surface, putting in between the stain. This is enough to emphasize the translucency inside the incisal edge.
Okay, so what is your trick to choose the correct shade faster from the composite system you have shown us in the lecture? Is it by your side and experience only, or you always put a part of composite and cure it, then see if the shade is good?
Yeah, at the very beginning of the presentation, I showed some slide about Jordi Manauta's realistic train. So basically, I get some composite. I'm not a fan of the bottom try technique, since the bottom try technique is not so effective to anticipate the real appearance of the further composite. So that's why you can replace the missing part of the tooth, and by applying on top some composite, you can finish and polish a bit in order to get a mock test really. And that's it's not a matter of experience. And I try to get some mock test with with different shades. I light cure the composite, and afterwards I ask the composite the patient to hydrate her teeth with his tongue with saliva by uh, imitate the further appearance of the final restoration. So it's a better performing way of do the color shade selection. Which percentage of your anteriors rest in single shade mask? Let's say 80%. 100% of the class 5 restoration, I mean. And regarding the class 4, 70%.
Could you explain a bit more about cuvata plan and the burr used?
Yes, cuvata planes are basically the three planes that every tooth is composed by. So we are an incisal edge, an incisal edge, and so an incisal plane, a middle plane, and a cervical one. So when you perform the finishing, your burr must be act like this. You have to change the inclination of your burr according to the cuvata planes. These are the cuvata planes. And the burr is a burr with a very rough, since this is the timer, 1 hour after starting the presentation. So regarding the burr I've used, I used to call it a magic burr because it's a very rough diamond burr. You can use at low speed on the handpiece. So the low speed is very, very helpful to control your burr while you are drawing the tertiary anatomy. And you can help yourself by drawing the three cuvata planes by drawing horizontal lines that split the tooth, each tooth in three parts: the incisal part, the middle part, and the cervical part. And you have to change the inclination of the burr every time you pass from the incisal to middle, from middle to cervical. Yes, the modeling liquid has any side effects. Yes, there's an article I can share with you afterwards that show that decrease the aesthetic appearance over the time. So I'm not a fan of the modeling liquid. And to get some effect of the modeling liquid, and if you really need to improve the handling of your composite, you can use some universal bonding, but be sure to dry the universal bonding a lot. But try to, this is a very, very common habit, but I don't recommend you, because even if so many authors recommend to use it, also the bonding has some effect on aesthetically speaking. So my suggestion is to wet your compo brush, for example, by using a small drop of the flowable composite, because flowable composite is it has the same shade of the packable one. Or anytime you can go as me by packing the composite in excess and removing the teeth during the finishing procedures. This is the more effective procedures, and I believe in this.
Where can I read about cubata plants? Any other article on this or on other polishing tricks?
On our books. And just 1 second. Here you can find everything you need about anterior restoration, also regarding the cubata planes, but cubata planes is anatomical features of the tooth. So basically, you know that you get some inspiration for the adjacent teeth not to treat, and to reproduce the anatomy, you just have to watch your patient teeth. Always taking pictures, studying picture, get impressions. This is the very, very helpful trick I can recommend you to study the anatomy. So cubata planes are a trick. And I don't know how to explain it, but take inspiration from the adjacent teeth first. Afterwards, you can look for some information about the cubata plants, and you just have to try to do your best during the finishing procedures, because even the ugly anterior restoration can become a very, very nice one thanks to the finishing procedures. And about the polishing tricks, even on the layers too.
Okay, perfect. I think there is no other question for you, so we can end our webinar. Thank you again, and you receive a lot of compliments, congratulations from a lot of colleagues. So I think it's very good. Thank you, Alessandro. Thank you to Still Italiano for the webinar. Thank you, everyone.